The new report from the Science Advisory Table is sharing its findings in using an antidepressant to treat COVID-19. Fluvoxamine is typically used to treat anxiety and obsessive compulsive disorder, but two new studies have now found it may be beneficial in treating COVID-19. For more on this, we're joined live tonight by pharmacist Kyro Maseh. Thanks so much for making time, Kyro. So tell us, what is fluvoxamine? What is it used for now, and is it safe to use for COVID?
Yeah, so fluvoxamine is, as a class, it is an anti-serotonin, selective serotonin reuptake inhibitor. One of the first in the early 80s, and it gained a lot of, in terms of an anxiety disorder as well as OCD. It does show a lot of promise in treating COVID and preventing hospitalization. So that's kind of the hot topic right now in terms of fluvoxamine.
Can you tell us a bit about how that relation was made? How will it help COVID patients when it's used for other things at the moment?
So fluvoxamine, fortunately, is already approved as a medication in Canada. So getting Health Canada approval is not a hurdle that a prescriber would have to face when prescribing it. In addition to it being an antidepressant, it also has an anti-inflammatory effect. So it is a bit of an oddball in its family. So that's the proposed mechanism of action. The science table very wisely suggested its use and recommended it and gave very specific criteria for some high-risk patients to get it prescribed for them and to be used in the first 7 days of infection, as that has shown to have a high efficacy in terms of preventing hospitalization and disease progression. Now, I will just try to stress the fact that very important that if you fall into one of these high-risk categories, that you communicate this to your prescriber or communicate this to your physician, because a lot of people are in fact not vaccinated or they're immunocompromised. They test positive for COVID using a rapid test or a PCR, and they're not really communicating this to their prescribers, so they're not getting a treatment like this one or another one's budesonide inhalers. They're not getting that in a timely fashion. And that is a very key element. We need to communicate to the general public who is high risk, and that they have to obviously inform their physician as soon as they do test positive, if they do test positive.
So explain that to us. Who is high risk at this point? I think about, vulnerable people, the elderly. Who should be using this?
So the Ontario Science Table, again, they very correctly went and stated the highest risk categories, and the ones that really do stand out is the unvaccinated. So if you're unvaccinated, you already know you have a higher risk of hospitalization, and so it would be very important that you inform your physician if you do test positive. This way they can give you a treatment that could help prevent you from progressing to hospitalization and further complications. Same would apply for people on immunosuppressive medications. If you're taking medications for rheumatoid or psoriasis, lupus, or if you're a cancer patient. So these are all high-risk categories. Obviously, in addition to the Indigenous population, as well as people above the age of 60, if you have heart disease, if you have diabetes, talk to your physician. They will be the ones to judge the benefit versus the risk of taking this medication, and they will be able to make that recommendation, make that judgment call in a timely fashion to prevent disease progression in your specific circumstance.
Yeah, you've talked about the timing being really important if you are using this drug. Can you tell us about whether we have any idea, I know it's early days, but any idea about how effective fluvoxamine can be in, preventing death or hospitalization when it comes to COVID?
So the studies are showing in those specific populations has shown a 32% or roughly 30% reduction in progression to hospitalization versus people that don't take it. Obviously, we're not going to be recommending this for everybody in the province that gets COVID, but we already know that there's certain people that are high risk, and that's exactly why the Ontario Science Table went and specified who should get this medication prescribed to them if they do test positive. They didn't recommend it for the entire population. They recommended it to specific groups. And again, it'd be very important for the Ministry of Health to communicate it, make this as public as possible so that these people can reach out to their physician should they test positive for COVID and receive treatment in a timely fashion.
Kyro, the irony here is that you mentioned that people at highest risk are people who are unvaccinated. So what message do you think this sends to people who are still not vaccinated? Do you think those people are less likely now to get inoculated when they know that there's treatment available later on?
So again, like people who are not vaccinated, they're not just one group. They have they come from a variety of different philosophies or a variety of different reasons for not getting vaccinated. But at the end of the day, I as a clinician who dispenses these medications, I can tell you that they do have side effects. They have a lot of side effects. They have a lot of interaction. In fact, out of that family, that drug is one of the ones that gets least prescribed because it actually has a lot of interactions with everything from drugs like clopidogrel, even caffeine. It could spike caffeine levels in your blood because it prevents its breakdown. So it's not the safest drug in the world, but there's a lot of cases where the benefits do outweigh the risks. So in all cases, it is a treatment option, but in my opinion, it would be a lot safer just to get vaccinated.
Okay, good to know. A really interesting conversation. Kyro, thanks so much for your time tonight. We appreciate it.
Thank you for having me.